Hello everyone, my name is Joanne and my poster is on bed alarms. The purpose of this poster is to determine the effectiveness of the use of bed alarms in preventing falls in high fall risk patients. So the relevant patient population that we're looking at are any high fall risk patients, including patients with a previous fall history, whether that be at home or in the inpatient setting, high fall risk meds, patients that have more than one or two patient equipments like IVs, SCDs, monitoring equipment, confused patients. We're looking at elderly patient population, patients who could be in the ICU or the med-surg unit, or any inpatient unit in the acute hospital setting, patients in the nursing homes. The usual patient outcome are that the patient falls. Patient falls exist in patients who do not have fall interventions in place. So I looked at 3 research articles. The first one is the effects of an intervention to increase bed alarm use to prevent falls in hospitalized patients, a clustered randomized trial. In this article, it discusses a randomized trial over an 18-month period with 27,672 patients in all units of the hospital setting. Nurses were educated and trained on the use of bed alarms. The results showed an increase in bed alarm use, but no significant difference in the decrease in the number of patient falls. And these results could be attributed to several factors, including alarm fatigue. The second article is bed exit alarm effectiveness. And in this article, it discusses the results of a study conducted in a 120-bed nursing home. 14 residents participated in the study that lasted 256 nights. The results show that different types of bed alarms, the pressure sensitive and a dual sensor system, work for different types of residents. Some residents were shown to move and exit the bed without triggering the bed alarm. Thus, other methods in addition to bed alarms should be implemented based on individual patient characteristics and needs. The third article was the effectiveness of a wireless modular bed absence sensor device for fall prevention among older inpatients. In this study, there's discussion about the uncontrolled design study of 47 patients who are age 65 or older in an inpatient geriatric unit. 77% of the nurses felt that the bed alarms were useful for fall prevention. The sensitivity rate of the bed alarms were at 100% and the nuisance alarm rate was at 32%. This study revealed that when used properly and when nurses responded to the bed alarms, falls were prevented in the patients participating in the study. So when you look at these articles and evidence-based practice, it does show that bed alarms do help in preventing patient falls when used properly and in addition to other fall prevention practices. Guidelines such as the Clinical Practice Guideline for Falls and Fall Risk have been shown to address 4 phases to assess a patient's fall risk and provide interventions to decrease the risk of falls in those patients. These 4 phases include recognition, assessment, treatment, and monitoring. I have a table that I have provided, and this is from the Clinical Practice Guideline for Falls and Fall Risk, Vance 2011, and it shows you the 4 different phases. In the recognition phase, step 1 is you ask, does the patient have a history of falls? Step 2, is the patient at risk for falling? In the assessment phase, you have 3 questions or 3 steps. Has the patient just fallen? Evaluate factors associated with the fall. Identify patient's actual and potential complication of falls. In the treatment phase, you have steps 6, 7, and 8, which is develop a plan for managing falls and fall risk, manage the cause of falling, implement relevant general measures to address falling and fall risks. And then you have the monitoring phase, which includes steps 9 and 2, which include monitoring falling in patients with a fall risk or fall history, and establish quality improvement activities related to fall risk and falling. So the conclusion is that bed alarms, when used properly and in addition to other fall prevention methods, such as use of fall mats, high fall risk bracelets, high fall risk socks, and indicators outside of patient's room, do help reduce the number of falls. However, alarm fatigue, in addition to other patient factors, could contribute to falls when bed alarms are in use. As nurses, we must ensure patient safety by adhering to guidelines and hospital policies in regards to high fall risk patients.